Hi everyone, welcome to Love and Guidance. Mama Marina here. And today's topic is on the category of self, and in particular, disempowering illness. So we're going to disempower illness. And what does that look like to disempower illness? Well, many of us, very few of us actually, in our entire lifetime get away with never experiencing any health problems or challenges. Most of us in our entire lifetime will have one or more health issues or problems. It can be from the common cold all the way to cancer and even Alzheimer's. And so it's important to remember that our health is uniquely ours. That even though we may catch pneumonia and somebody else may also have pneumonia, their body is very different from our body. Our body is ours, theirs is theirs. And so their body may respond to different treatments very differently than ours would. So even though we may speak to somebody who has experienced the same or a similar health problem, they may not necessarily be exactly the same. And the reason for that is because we're two totally different, unique individuals. Our bodies are going to respond differently to the treatments. And so we have to keep that in mind when we're going through health challenges. Just because your mom says, oh, I've been through this and this is how I reacted, and that may not necessarily reflect how you will respond to a treatment or to that ailment, how you'll experience that ailment, health ailment. So keep that in mind, that other people's input into your health challenge is just that. It's input, but it's not necessarily something to just absorb as truth. And that includes your doctors. So all of us, we trust our doctors. They're highly educated, highly knowledgeable human beings, and we trust them. We tend to trust them. Even our nurses, the nurse practitioners, we trust them. There's an underlying foundation of trust that they're not going to mislead us or give us an improper treatment for our health problem. And so that trust is deep. That's one of the things that we found on. But understand that nobody, not even your doctor, not the nurse practitioner, not any healthcare provider, knows your body better than you. You are the only person who truly knows your body. Why? Because it's your life energy that is housed within it. It's housed within it. Your body is yours. Nobody else can tell you what you're feeling except you, because you're the one that is currently residing. Your life energy, your soul, your spirit is currently in that vessel, which is the human body, yours. And so although their recommendations are to, again, to be listened to, and you're not going to just, the doctor has something to say and you just say, quiet, doctor, I don't want to hear anything you have to say. Take the recommendations in, but then you are ultimately your own boss. You're the boss of yourself, and you can make the call as to what treatment you are okay with actually taking, what is aligned with you. So if you go to one doctor and you are diagnosed with a particular health ailment, you don't have to just fly with whatever that doctor proposes as the treatment plan. You actually have options. You can go to another doctor. You can get a second opinion, a third opinion, a fourth opinion. You can get as many opinions as you'd like. In fact, you can shift gears and say, okay, I've gotten a couple of opinions from the traditional doctors. Now I'm going to go and see what holistic or alternative medicine practitioners have to say about what I'm currently experiencing, and get a different perspective on how to best treat your particular health ailment. And so you have options. You're not stuck with just one doctor, one opinion, one treatment plan. You can get a variety of different inputs, right? Different health practitioners can give you their input, their best opinion as to what you're experiencing and how best to treat it or cure it. And then you have to go within and decide what is truly best for yourself, because it's ultimately going to be your body. Those treatments are for your body, not the doctors, nobody else's, your mom's, nobody else's. It's your body that is going to be experiencing, whether you're taking a pill, whether you're getting chemotherapy, whether you're getting dialysis, whatever your health ailment is, and whatever the usual treatment protocol is, you are ultimately in charge of deciding what you're comfortable with doing and taking and so forth. And so to disempower illness means to weaken it. You don't strengthen it. You're weakening the illness and you're empowering yourself. And what does that look like, to disempower illness? Well, many of us, when we are diagnosed with a health issue, instinctively the mind wants to go to the negative. It always does that. We always find faults. We always go to the negative right away. Boom, boom, boom. And it's not, it's instinctive. It's not maybe the best way, but it is usually our human nature to go and find the negative. And when we go into the negative, when we allow our mind to go into the negative with regard to our own health challenges, we run the risk of victim mentality. So victim mentality is, oh, why me, and so forth, where we start to get into a real bad, it's an energetic place where we are feeling victim of this disease or this health crisis. And that is very bad, because the minute that you allow yourself to start vibing at that low place where you're the victim and you are helpless and you're hopeless, and it can spiral into a very bad outcome. And so you have to maintain, you got to be the boss. I am the boss of me. You have to be the boss of you, especially for when it comes to your own health. And so when you're presented or diagnosed with a health issue, it's important for you to maintain a strong mind and maintain control of your emotional energies. You are in charge. You hold the reins. You are the captain of your body. So you are in charge. And as such, leaders don't just willy-nilly go and do whatever the first person tells them to do. They have to think. It's a strategy. They are actually using their mental knowledge. Let me fully understand the scope of what is going on. Let me educate myself so that there's a clear understanding of all of the different treatments for this particular health problem. And then I can decide as a leader, as the boss of myself, how I want to proceed forward. So prevent yourself from falling into that victim mentality, that low energy mentality where you are feeling helpless, hopeless. That doesn't help the problem at all, where you feel like, this is the end. Or anything, how am I supposed to overcome this? This is bad. That is not going to help the situation. Number one is to empower your mind towards health. You believe wholeheartedly, optimism, attitude, positivity. You believe wholeheartedly in yourself and in your body that you are able to overcome this particular health issue, period. You believe that. You hold on to that hope. You hold on to that belief. You hold on to the belief within yourself that you can do it, you can overcome it. And so that is one of the main key ways to disempower and to weaken illness, is by empowering and strengthening you, your mind, your mental energies toward it. Okay? You got to keep it in perspective, because the minute that you start falling into that victim mindset, that you're sick and I have to go through all of these treatments and all of this thing, the minute you start falling into this horrible, like, disempowered place, that's when the illness itself gets mightier. So you cannot fall weak and give illness this upper hand of strength. You cannot do that. Do not do that. It is just not okay. You have to hold the upper hand. You have to, and illness has to be the weaker one. You're stronger mentally, physically. Believe that you will overcome your health challenge, whatever that health challenge is. It starts with you, owning you 100%. 100%. Mental energies, emotional energies, and believe in your body that it can do it and that you're able to do what you need to do. If you're overweight and your doctor says, hey, if you don't lose weight, you're going to have a heart attack, you're going to die. You own you. What do you need to do in order to not die? What do you need to do? And find out. Your doctor will tell you one thing, maybe go to another doctor, do some research of your own. What do you need to do to lose some weight so that your heart is not working overtime, trying so desperately to pump blood to excess weight, to a body that it was not designed to pump blood to. It was designed to pump blood to a smaller body. But the excess weight is the part that your heart is like working extra hard, trying to get that oxygenated and get the circulation to that extra mass, that extra body, that extra part of your body anyway. And so that is what my mama's loving guidance to you today is, to disempower illness by empowering yourself, empowering your mind, empowering your belief in your own body and the healing of your own body and the strength of your own body. And, sometimes I hear healthcare practitioners give a guesstimate. I call it a guesstimate. It's a guess and it's an estimate. And so somebody who, let's say, is diagnosed with cancer, the loved ones might ask the doctor, well, how much longer do they have to live? And the doctor will give a guesstimate of 3 months, let's say. And the problem with giving guesstimates is that it's coming from, number one, a human, and all humans, regardless of how educated we are, we know very little on the whole cosmic universal scope. There is a larger intelligence working behind the scenes here. There's a larger intellect that's at play, and we hold just a fraction of understanding of all of it. A fraction. And we're making strides, as the decades pass, we keep making strides, learning more and more and more, but we got a long way to go. So your doctor, your healthcare practitioner, it's a guesstimate. They're a human with limited knowledge of the whole thing that is destined for you. So they can give their guesstimate, this patient has roughly 3 months to live. But the problem with that is that that guesstimate could become prophecy, because the minute that patient hears that guesstimate and they tabulate in their mind, I only have 3 months to live, that's what they might be operating on. They can be operating on the belief that they only have 3 months to live. And the minute that truth, that belief goes into them, they can live that out. And in 3 months, they end up passing away. So we have to be very careful what ideas, what guesstimates we give to other people in terms of who they are. Like, yes, okay, this health ailment might generally, at this stage, might generally usually leave the person roughly 3 months to live. But the patient honestly doesn't know if it's going to be 3 months or 6 months or 9 months or a year and a half or 5 years or 7 years. The doctor does not know that. They don't have a magic wand to just ding onto their patient and say, okay, you only have 3 months more to live. Make it worthwhile. They don't have that power. And so those type of guesstimates, take them again as input, but not necessarily fact and truth, because I have heard many patients who have been diagnosed with something and their guesstimate was that they would only live a few months beyond that diagnosis, and they lived long after, simply because they owned themselves. They had a mind that they were going to battle. They were going to go to battle with this health ailment, and they battled it, and they came out victorious. They came out victorious, not the bug that was in them, not the health ailment that the health crises that was a part of their life. It was them. They battled. That's why cancer, you hear, oh, it was a cancer battle. It was them against cancer. Okay? It's a battle, and there's going to be someone who's victorious, and there are people who get cancer and they survive it and they win, and cancer never comes back. I'm a prime example of that. Had cancer many years ago, has never come back. And why? Because I've changed my ways. I have a pretty good understanding of what causes cancer, and so I've changed my ways to avoid that, and now I've been cancer-free ever since. And there are those who go and do the cancer battle, and cancer beats them, and they end up passing away. And so I know that is true, because my dad was a prime example of that. He got cancer, it came back, and it checked him out. So victim mentality is huge. Do not allow victim mentality to strengthen your illness and to disempower you. Flip that. Empower yourself with a very strong mindset on owning yourself, your body, your treatment, all of it, so that you can disempower illness. You make the illness itself weaker. And just because your healthcare practitioners give you guesstimates, or other people who have similar health crises give you their feedback, remember, you are uniquely you. You are uniquely you. You are going to respond to these treatments. You are going to respond to everything that you need to go through this health crisis uniquely in your own way. You cannot compare yourself 100% to anybody else. You just can't. Their body's theirs. Your body is yours. Different reactions, different responses, different all of that. Okay? Different severity in terms of the effect of, let's say, pneumonia. You have pneumonia, your friend has pneumonia, or she had pneumonia, and she tells you all about how she overcame it. This is your body. How is your body needing to overcome the pneumonia that you have? And that's where the magic's at, when you fully believe in your body, are one with your body and make the best choices for your particular body. Get all the information, talk to as many healthcare practitioners as you need to, however many doctors, however many holistic or different, naturopathic type practitioners. Get as much feedback, get a full understanding, and then make the best choice that feels right within you for yourself. That's my loving guidance for today. That's mom's advice. That's exactly what I did many years ago when I was diagnosed with cancer. I knew what led me up to that, and I knew what I needed to change post-cancer, after cancer, how that was going to be just a different person, a different way of being, a different way of conducting myself in life. And so all of the information that I gathered during that particular health crisis bubble, it was valuable. But in the end, I had to apply what I felt was appropriate for me. And it did go against some of the recommendations that the doctors had given me. And it did go against some I pushed back on, just because they told me that this is the traditional way of treating this and this is what they want to do, does not mean that I have to just, go along, be the sheep that follows along. I chose to make the best decision for myself based on what I was okay with doing. And so please make sure that you do the same. Honor yourself. Honor what is inside of you, what tells you is right or wrong within you. If something doesn't feel right, you can stop a treatment. If it's reacting negatively, stop it. You don't have to keep on when you know that it's affecting your physical being in a negative way. So please be the boss. There was this old lady. She was older, like in her 90s, and she always, you may have seen her on the internet. She was doing yoga for the vast majority of her life. Suddenly she had this hip problem, needed surgery, and the doctors told her, you're not going to be able to be doing this kind of stuff anymore. We just replaced your hip. And she said, I'm the boss. You're not the boss. I'm the boss of me. I will choose and be able to decide whether or not I'm able to continue my yoga moves or modify my yoga moves with my new hip. I get to call that shot. Thank you for replacing my hip. It needed to be done. But now, from here on out, don't tell me what I can and cannot do. I get to choose, and I will determine that based on my pain and based on what I feel, my own sensations in my body with my new hip. And so empower yourself. Make sure you're strong. Make sure that you're mentally strong. You're emotionally in control, and trust your body, what it's telling you, the signals it's sending you, all of the messaging that it's telling you. This hurts. This is too much. Whatever it is, whatever it's telling you, take heed, respect it. Okay. Until next time, my loves, disempower illness, stay healthy, stay strong, and we will talk again. And if you liked today's discussion or topic, please give a thumbs up and leave your own loving thoughts on this topic down in the comment section. And be sure to subscribe if you would like to join the Loving Guidance community family, so that you can continue to get my loving guidance for you, and we can share. It's all about knowledge sharing and wisdom sharing, and so that we can expand, grow, advance. And so be sure to leave your loving thoughts down below so that we can all share and learn from one another. Okay, my loves? Love you. Until next time.